JJ, thank you so much. The spine is the major thoroughfare of the body, and when it comes to caring for it, you don't want to leave things to chance. Our next guest is a world-class experienced surgeon. He's here to break down minimally invasive spine surgery compared to the traditional approach. I like minimally invasive. It's better than really invasive. Board-certified neurosurgeon Dr. Scott Glickman is here with Las Vegas Neurosurgical Institute. It's great having you, sir. Welcome back.
Thank you much.
So obviously, when you're getting spine surgery, this is incredibly important. It's also incredibly complicated. You like to take, whenever possible, a minimally invasive approach. Tell us the difference between that and your traditional spine surgery.
So traditional spine surgery is larger incisions frequently.
Yeah.
It's most important that there's stripping of muscle away from the bone, which is where a lot of disability comes from, or extending recovery and frequently pain. Minimally invasive surgery is often, but not always, smaller incisions, but more importantly, less destruction of normal tissues, and so you have less complications associated with bleeding, infections, and pain, as well as the disability that's often temporary but sometimes permanent, associated with the tissue damage.
Yeah.
The surgery itself is what's the necessary part, whether it's the decompression or the removal of whatever is there. That's the problem. And often with stabilization, whether it's putting in screws or screws and rods, cages and what have you, that is what the necessary surgical part is, and that can be done in an open fashion or a hybrid fashion or a minimally invasive fashion, all with effectively the same results as far as the stabilizing effect and the decompression. The difference is what is the residual,
what comes after.
What comes after.
Of course. Who makes a good candidate for a minimally invasive procedure?
So minimally invasive surgery can be performed on most anybody as far as size and shape and age. There are complicating factors that would lend themselves more towards open versus more towards minimally invasive, whether it has to do with the tools, it has to do with the depth that you're working at, as well as the pathology itself. If there's multiple levels that are involved and you have to do complete reconstructions on people, or if there's tumors involved, then you need to have more opening and to clear out more of the tumor, then that goes more towards open. If you have people that need more of focal areas where there needs to be decompression or such as a laminectomy or a discectomy part, and there needs to be some stabilizing factor associated with that, we typically can do that in a minimally invasive fashion.
What are some of the most common problems you're seeing come into the office?
So the most common problems that we'll see are spinal stenosis, herniated discs, radiculopathy, which is the compression of a nerve, a pinched nerve. Okay. Patients who have joint problems, spinal instability, compression fractures, a variety of those things that you might have heard.
And I know Las Vegas Neurological Institute, you do a myriad of different procedures. Tell us about the wide array of things you cover.
So myself and my partners do the whole spectrum of neurosurgical care, from brain surgery to peripheral nerve surgery and most likely spine surgery, since that's where most of the neurological problems are. The surgeries that we do are anything from laminectomies and discectomies to spinal fusions, reconstructions, resections of spinal tumors, spinal cord problems, and other things like carpal tunnel surgery, spinal cord stimulators, deep brain stimulators, etc.
Absolutely. There are people that live out there, they have this spine issue, they have this back problem, and they're just like, you know what, I have to live with it. I'm just going to take some Advil, pretend it's not there. What do you say to people that are watching right now that might need to do a little more?
So what people need to think about when they are suffering is this something that is the juice worth the squeeze, so to speak? If you are suffering with this problem and you're noticing it's getting worse, it's not improving at all, it's starting to affect your day-to-day life, then this is something that you need to consider having evaluated. It doesn't necessarily mean you're the best candidate for surgery now or that you won't be later. It's the same thing as any other medical problem. If you are feeling it, then you should consider getting it evaluated by somebody who's going to be able to give you the pros and cons of whether or not it's appropriate for fix.
And sooner you get it addressed, the better your results could be.
That's right. The sooner the better. You know, in a lot of cases, there are many things that can be done that are non-operative before you would need to consider an operation. However, you know, we're dealing with opiate addiction in this country and other medication problems. You know, a lot of times you have a lesser problem that would potentially benefit from surgery, but eventually you're going to need it. So why
don't kick
take
the can
all
down
kinds
the road.
of don't kick the can down the road.
Absolutely. Doctor, it's great having you.
Thank you much.
Thank you so much. Hey, listen, visit Southern Nevada's first choice for spine and brain surgery. It's the Las Vegas Neurosurgical Institute. They're located on South Durango, just north of DI. Their website and number are right there on your screen. Las Vegas Neurosurgical Institute, a proud sponsor of the Morning Blend.